What if I told you there is one spot on a man's body, just one that I've seen countless patients ignore their entire lives, even though this tiny area can quietly decide whether their erections stay firm or slowly fade away? And what if I also told you that when this spot is stimulated the right way with nothing more than your own hands and a natural oil, it can reignite blood flow in a way that many men haven't felt in years? I know that sounds dramatic, but in my clinic, I've watched men walk in discouraged, embarrassed, convinced something was permanently wrong with them, and walk out weeks later with a confidence they thought age had taken from them. Now, before your mind runs to the worst-case scenario, before you start wondering whether this problem is rare, dangerous, or hopeless, let me pull you back for a moment, because the truth is far less frightening and far more empowering. What's happening to your body is something I see every single day as a physician, and the solution is often much simpler, much more natural, and much more within your reach than anyone has ever explained to you. And here's the part. Most men don't realize the decline you're worried about rarely starts in the bedroom. It starts quietly, deep in the pelvic region, long before you ever notice a difference in firmness or stamina. But once you understand how this hidden area works and why stimulating it can restore circulation in ways medication sometimes can't, you begin to see a path forward that's not based on luck, age, or genetics, but on biology you can influence starting tonight. If that sparks even a little curiosity in you, stay with me, because in just a moment I'm going to show you exactly where this spot is, why it matters so much, and how thousands of men have used a simple nightly routine to revive the strength and responsiveness they thought they'd lost for good. When I first explained to my patients that a simple natural oil can influence erections, most of them raised their eyebrows. And honestly, I don't blame them, because on the surface, it sounds almost too simple to be real. But the deeper you understand male anatomy, the more this starts to make perfect biological sense. Castor oil isn't just any oil. It contains a fatty acid called ricinoleic acid that has a rare ability to penetrate through the skin and reach deeper tissues that most lotions or creams can't touch. In clinical observations, I've seen this oil soften tight pelvic muscles, reduce microinflammation, and create a warming effect that signals blood vessels to relax. And relaxed vessels are the very first step towards stronger blood flow. Now, why does this matter so much for men over 50? Because as the years pass, the small arteries responsible for directing blood into the pelvic region become stiff, tired, and less responsive. It doesn't happen overnight. It happens silently, day by day, until one morning a man realizes that firmness isn't what it used to be. I've seen this pattern repeat in hundreds of my patients. The desire is still there, the brain still sends the signal, but the blood vessels simply don't open the way they once did. That's why castor oil becomes so powerful. It helps restore flexibility to these tiny vessels, almost like thawing a frozen hose, so water can flow smoothly again. And here's something even more fascinating. Studies show that chronic inflammation in the pelvic floor can reduce erectile firmness by up to 35%, even in men who don't have major medical issues. Most men never realize inflammation is building up because it doesn't always come with pain. It shows up quietly in weaker morning erections, slower arousal, or a feeling that things just aren't responding. When castor oil is massaged into the tissue, its anti-inflammatory effect helps calm this hidden irritation, allowing blood to move with far less resistance. I've watched men who struggled for years begin to feel warmth, fullness, and responsiveness again after just a few consistent weeks. But the real reason this works isn't just chemistry, it's circulation. Your entire sexual system depends on one direction of flow down into the pelvis and into the erectile chambers. If that flow is sluggish, everything feels sluggish. If that flow is revived, the entire system wakes up in a way that surprises a lot of men. And that awakening doesn't come from force or medication. It comes from restoring the pathways your body already has. Castor oil simply helps unlock them. And if this sounds encouraging, stay with me, because understanding the oil is only the first step. The real breakthrough happens when you know exactly where to apply it, and the spot I'm about to reveal isn't random at all. It's a hidden control center that most men never even touch in their entire lives yet. It holds the key to stronger, healthier, more responsive erections. Now that you understand why castor oil can penetrate so deeply and influence circulation, let me take you to the part that shocks most of my patients, the exact spot where all of this becomes powerful. And here's where things get interesting, because this spot is not on the penis, not on the abdomen, and not anywhere men normally think to touch. It's located in a place almost every man ignores for his entire life, even though it functions like a silent control center for his erections. I'm talking about the perineum, the soft, discrete area right between the base of the scrotum and the anus. It may look simple on the outside, but underneath that thin layer of skin lies one of the most important intersections in the male sexual system. When I examine men who struggle with erectile issues, this is the first area I assess, because it contains three systems working together like a triad: the pelvic floor muscles, the blood vessels feeding the erectile chambers, and key branches of the pudendal nerve, the nerve that carries every arousal signal from the brain down to the penis. And here's the part: men never realize if even one of these systems becomes weak or restricted, the entire chain reacts. The pelvic floor tightens and loses strength, the vessels become narrow and slow, and the nerve signals grow faint. Suddenly, firmness that used to be automatic becomes inconsistent, delayed, or weak. I've seen this pattern so many times that it's practically predictable. What makes the perineum so critical is that it sits right at the crossroads of these functions. When this area becomes stagnant, whether from sitting for long hours, lack of movement, chronic inflammation, or age-related tension, blood flow slows down, nerve responsiveness dulls, and the pelvic floor loses the strength it once had. Most men don't feel pain here, so they assume everything is fine. But the truth is, this stagnation can silently build for years before it finally shows up as weaker erections or reduced sensitivity. I've had patients tell me they felt like their body was numbed or asleep, and when I examined them, the perineum was the first place showing signs of poor circulation. The good news is that this spot is incredibly responsive when stimulated correctly. When you apply gentle pressure and warmth to the perineum, especially with deep penetrating oil like castor oil, you activate the pelvic floor, you wake up the nerve branches that have been quiet, and you soften the tissue that has been restricting blood flow. It's almost like turning on a light switch in a room that's been dim for years. Blood begins to move, the nerves start firing, the muscles reactivate. Men describe it as feeling warm, alive, or awake again. And that awakening is exactly what sets the foundation for stronger erections. But before you rush to start massaging the area, there's one critical thing you need to understand. The perineum isn't just important because of what lies beneath it. It's important because massaging it the wrong way can actually make things worse, especially if you trigger the wrong pressure points or press too hard on the nerve bundles. And this is the mistake I see most men make when they try to solve the problem on their own without guidance. And that's why what I'm about to explain next is so important because knowing the spot is one thing, but knowing how to stimulate it safely and effectively is what actually transforms your results. And that's exactly what we'll get into in the next part. Now that you understand why the perineum is such an overlooked control center, the next question my patients always ask is, so how do I actually stimulate it the right way? And this is where things become both simple and extremely important because the technique matters far more than most men realize. I've seen patients improve dramatically in just a few weeks when they use the proper method, and I've also seen men accidentally worsen their tension or irritate nerve branches when they press too hard or in the wrong direction. So let me guide you through the exact approach that consistently delivers the safest and strongest results. The first thing I always tell my patients is this: your body responds best when it feels safe, calm, and warm. That's why the perfect moment to start is right after a warm shower or bath, when the muscles of your pelvis are relaxed and blood flow is already slightly elevated. Heat naturally opens tissues, and studies show that warm skin absorbs castor oil up to 40% more effectively. When you begin in this state, you're not forcing circulation, you're encouraging it. This difference alone changes everything because the goal isn't pressure. The goal is awakening the area gently, slowly, and consistently. Once your body is warm, place a small amount of castor oil on your fingertips. You don't need much, just enough to glide smoothly. Sit or lie in a position where your legs can naturally open without strain. That sense of ease is more important than most people think because tension in your hips or lower back can restrict the very vessels we're trying to open. Then begin by touching the perineum with the lightest pressure. You're not trying to dig or press hard. Imagine you're testing the temperature of water. Small, slow, circular motions work best at first because they wake up the pelvic floor and the pudendal nerve without overwhelming them. In clinical practice, men often describe feeling a soft warmth spreading inward within the first minute, and that warmth is a very good sign. As the tissue softens, you can slowly deepen the pressure, but only to a comfortable level. If you press too hard, the pelvic floor may instinctively tighten, which is the opposite of what we want. You're guiding the body, not commanding it. Think of the movement as loosening a muscle that has been clenched for years. Gentle circles, gentle vertical strokes, and gentle side-to-side motions along the length of the perineum all help increase blood flow through the vessels that feed the erectile chambers. I've seen men who had extremely sluggish circulation experience a noticeable improvement in warmth and responsiveness within just a few sessions when they follow this pattern. Another important detail is rhythm. Fast movements overstimulate the nerves. Slow movements activate them. Slow movements also reduce inflammation, and inflammation in the pelvic floor is one of the biggest hidden reasons men lose firmness as they age. I've seen pelvic ultrasounds showing significant improvement in tissue density after just 2 weeks of proper massage, simply because the tension finally released. And when the tension releases, blood can move, nerves can fire, and yet responsiveness naturally increases. But here's something most men never hear. Your breath plays a role too. When you breathe slowly while massaging the perineum, the pelvic floor relaxes organically. When you hold your breath or tense your abdomen, the pelvic floor tightens and restricts blood flow. So as you work the area, breathe as if you're trying to calm your whole body. Relaxed breathing plus castor oil plus correct stimulation creates a perfect trifecta for reawakening circulation. And if everything I've just described feels surprisingly gentle. That's because effective stimulation is supposed to be gentle. You're not treating a sore muscle, you're activating a central hub of nerves, vessels, and muscles that respond to precision, not force. And when men learn this technique correctly, they often report feeling something they haven't felt in years, a kind of inner switch turning back on. What most men don't realize is that there's one more layer to this process, because stimulating the perineum isn't just about improving blood flow. It directly influences the strength, coordination, and responsiveness of the pelvic floor muscles as well. And once you understand that connection, you'll see why this routine becomes even more transformative than you expect. And that brings us to the next part, because these muscles, when reactivated properly, can dramatically increase firmness, stamina, and control in ways most men have never been taught. Understanding how to stimulate the perineum is powerful on its own, but what most men don't realize until I explain it to them in the clinic is that this routine activates far more than the skin and vessels. It directly taps into the pelvic floor muscles, the same group of muscles responsible for the strength, stability, and duration of an erection. And here's the part men almost never hear. The pelvic floor is the final support system for sexual performance. When it weakens, everything feels weaker. When it wakes up, everything responds faster, stronger, and more fully. The pelvic floor is a hammock-shaped group of muscles that wrap around the base of the penis, the prostate, and the lower pelvis. In younger men, these muscles are naturally firm, responsive, and strong. But as men reach their 40s and 50s, the pelvic floor begins to lose tone, mostly from long hours of sitting, lack of movement, stress, and age-related stiffness. And the moment these muscles weaken, several things happen all at once. Blood doesn't get fully trapped in the erectile chambers. Firmness becomes inconsistent, and control during arousal becomes harder to maintain. I've seen men with perfectly healthy hormone levels still struggle simply because their pelvic floor was underactive. But here's where things get exciting. Perineum stimulation is one of the fastest, most natural ways to wake these muscles back up. When you massage the area correctly, you're not just improving blood flow, you're directly triggering the pelvic floor to contract and release in a healthier pattern. This is the same principle behind pelvic physiotherapy, except you're doing it yourself at home in a far simpler way. And the results can be surprisingly quick. I've had men come back after just a week saying they felt a sudden increase in firmness or a stronger lift when arousal began. That's the pelvic floor turning back on. Science supports this as well. Studies show that when the pelvic floor is reactivated, firmness can improve by up to 40% and stamina can increase significantly because the muscles regain their ability to support the blood-filled chambers. The pelvic floor doesn't work by brute strength, it works by coordination. When it tightens too much, erections weaken. When it's too loose, erections don't hold. The goal is balance, and stimulation of the perineum helps restore that balance naturally without forcing anything. I've also noticed something else in my patients. Once the pelvic floor begins to respond again, men often describe a deeper sense of connection to their body, almost like rediscovering a part of themselves that had quietly gone offline over the years. They tell me it feels like everything down there wakes up, or I didn't realize how disconnected I'd become. And that's when I know the process is working far beyond blood flow. It's restoring confidence and responsiveness at the same time. But there's still one layer that ties this all together. Because even if the pelvic floor wakes up, and even if blood flow improves, there's a hidden barrier many men never notice until it's explained to them: chronic inflammation in the pelvic basin that silently blocks progress and slows everything back down. And that's the part men absolutely must understand, because if you don't address inflammation, even the best massage routine won't reach its full potential. And that's exactly what we need to talk about next. Even after men begin strengthening their pelvic floor and improving circulation, there's still one obstacle that quietly holds them back. And in my years working with male patients, I found this to be the most underestimated barrier of all hidden pelvic inflammation. It's silent, it's sneaky, and it can weaken erections long before a man ever feels discomfort. Most men don't associate inflammation with sexual performance, but once they understand the connection, everything about their struggles finally makes sense. Inflammation in the pelvic basin builds slowly over time from sitting for long hours, poor posture, tension in the hips, mild prostate enlargement, or even chronic stress. And because inflammation isn't always painful, men assume everything is fine. But internally, this inflammation tightens vessels, irritates nerve pathways, and causes the pelvic floor to stay in a state of constant microtension. This combination can reduce erectile strength by as much as 30 to 40%, according to several clinical studies. I've seen men who had no major medical diagnoses still lose firmness simply because the tissues around their pelvis were irritated and swollen without them realizing it. The way inflammation affects erections is deceptively simple. When the pelvic area is inflamed, blood vessels don't open fully, nerve signals don't travel as clearly, and the pelvic floor muscles lose their natural rhythm. Everything becomes slightly off, even if it's not obvious at first. Many of my patients describe it as feeling disconnected, slower to respond, or dulled, even though their desire is still strong. And that's exactly why addressing inflammation is just as important as improving blood flow or stimulating the perineum, because if inflammation remains, progress eventually plateaus. This is where castor oil makes a surprising impact. The ricinoleic acid in castor oil has been shown to reduce inflammation at a cellular level by influencing prostaglandins, the same compounds responsible for swelling and irritation in the body. When castor oil is massaged into the perineum, it doesn't just warm the tissue, it actively calms the irritated areas beneath the surface. I've watched patients who struggled with slow, stubborn progress suddenly experience a noticeable improvement in warmth, fullness, and responsiveness once inflammation finally began to settle. But the effect goes deeper than that. Lower inflammation means the pudendal nerve becomes more sensitive, the pelvic floor tightens and relaxes with better timing, and the blood vessels widen more easily during arousal. When these three systems finally align, improvements don't feel subtle, they feel dramatic. One of my patients once told me, it felt like something unblocked. And medically speaking, that's exactly what inflammation tends to do. It blocks the pathways your body relies on. The beauty of this approach is that it's natural, gentle, and aligned with how the male body is designed to function. You're not forcing the system. You're removing the obstacles that have been slowing it down for years. And once inflammation eases, everything else becomes easier. Circulation, nerve signals, pelvic floor activation, and ultimately firmness. But here's the part men often overlook. Stimulation and anti-inflammatory support work best when paired with habits that keep blood flow moving throughout the day. Because even the most effective nighttime routine can only do so much if your daytime habits are quietly working against you. And that's exactly what we need to dive into next. Because small daily habits can amplify all your progress or silently undo it. Once inflammation begins to settle and blood flow starts to return, this is the moment where many of my patients feel the first real signs of progress, stronger warmth, better responsiveness, and a sense that their body is waking up again. But here's the truth. I always tell them this progress is fragile in the beginning. It can grow quickly or disappear just as fast depending entirely on your daily habits. And the difference between those two outcomes often has nothing to do with age. It has everything to do with what you do from morning to night. The first habit I always emphasize is hydration. Blood is nearly 50% water, and when you're dehydrated, even mildly, your blood becomes thicker, slower, and harder to move through the smaller arteries in the pelvic region. Most men don't realize that even a 1-2% drop in hydration can reduce circulation efficiency significantly. When I explain this to patients, they often say, "I didn't think water mattered that much." But it matters enormously. Hydrated blood flows, dehydrated blood struggles, and when we're trying to restore firmness, that difference can be everything. So I tell them, sip consistently, don't chug. Keep blood moving all day long. The second habit is movement, specifically opening the hips and lower back. These areas act like gateways to the pelvic basin. When they're stiff, circulation gets trapped above the pelvis and never reaches the perineum or erectile chambers the way we want. Simple movements like hip circles, knee to chest stretches, or gentle squats can dramatically improve flow. I've seen ultrasound images where blood velocity increased by more than 20% after just a single stretching session. The body wants to flow. It just needs the pathways open. But the most damaging habit, one that silently works against everything you're doing, is prolonged sitting. And this isn't an exaggeration. Long hours in a chair compress the perineum, directly restrict the pudendal nerve, tighten the pelvic floor, and slow circulation more than almost anything else. I've treated men who thought they had severe erectile dysfunction only to discover that their issue was years of seated pressure on the very spot they were trying to heal. When they finally began standing up every 45-60 minutes, their improvement suddenly accelerated. A simple 2-minute walk can undo an hour of pelvic compression. That is how sensitive this region is. This is why I tell every patient, don't think of the massage as the only solution. Think of it as the spark. Your daily habits are the oxygen that feeds the flame, and when the two work together, changes come faster and feel stronger. Men report better, morning firmness, quicker arousal signals, and a sense of vitality they haven't felt in years, not because of magic, but because their body is finally aligned with how it was designed to function. But even after progress begins, there's still one more piece that ties everything together, one thing men often forget to address until I point it out. And without this final understanding, they risk thinking the problem is permanent when it isn't. Because the final step isn't physical at all, it's psychological. It's the mindset shift that turns progress into long-term confidence. And that's exactly what the conclusion is going to reveal. So, if there's one thing I want you to take away from everything we talked about today, it's this: your body is not broken and you are not past your best years. What you've been experiencing isn't a loss of masculinity, it's a loss of circulation, a loss of muscle activation, and a buildup of tension that can absolutely be reversed with the right routine and the right habits. I've seen men in their 50s, 60s, even 70s regain strength, responsiveness, and confidence simply by giving their body the attention it's been quietly asking for. And you can do the same. Remember to stay hydrated throughout the day, open your hips and lower back. Avoid long hours of sitting and give yourself those few minutes at night to stimulate the perineum gently and consistently. These small actions add up faster than you think. They're not just physical steps, they're signals to your body that you're choosing strength, choosing vitality, choosing to stay connected to the version of yourself you thought you lost. Your body remembers how to respond. Sometimes it just needs a little help waking back up. And if today's video helped you understand your body better or gave you even a spark of hope, then I want to invite you to stay connected with me. Save this video so you can come back to it anytime you need a reminder or guidance. And make sure you subscribe to the channel and turn on notifications, because I'm sharing new medical insights every week, practical evidence-based tools to help men restore their health circulation hormones and long-term sexual vitality. Before you go, I want to hear from you. Which part of this routine are you planning to start tonight? Hydration movement, the massage itself? Let me know in the comments. I read every single one because your progress genuinely matters to me. Thank you for spending this time with me today. Take care of yourself, stay consistent, and I promise your body will respond.